Thank you very much for having me this morning and allowing me to talk about some of the things that Laing O'Rourke have been doing over the last number of years, which we call doing mental health and well-being differently in the workplace. And I just wanted to explore with you how to get started, but also some of the pitfalls that we've had along the way, how we believe that creating that compelling case for change for mental and well-being is really, really important, how you can provide resources to people that raise awareness in the workplace, and how it all links back to the health and safety management system. Laing O'Rourke have been working on their mental health and wellbeing action plan since about 2015, but probably the biggest game changer for us was when we linked our mental health and wellbeing strategy and action plan to our next gear safety principles. And this really talks to what Helen was talking about the sense of place, this positive psychology approach. And what that means for us is that we see people as the solution to their own mental health and well-being. And we want to look at the positive aspects of how they can support their own mental health. And it's really important that the programs we deliver under the mental health and well-being strategy are an ethical responsibility as opposed to just ticking boxes. So we created this real compelling case for change around mental health and well-being. And we divided that into these categories that you can see here. And this is how we build our Life at Laing O'Rourke platform. So we look at well-being in terms of the workplace, physical, social, mental, and financial aspects. And this Life at Law hub that we've created provides a one-stop shop for all our mental health and wellbeing resources for our staff and our people. And now our wellbeing committee are a cross-functional committee from each discipline in Laing O'Rourke. So we have leaders from the people function, we have leaders from the technical function who sit on our wellbeing committee, and that allows us to make sure that we've got really good diversity in our thinking and our thoughts, and that allows us to drive our campaigns and programs cross-functionally across Laing O'Rourke. And this platform gives us a real opportunity to be able to share all our resources in one-stop hub. Now, probably the biggest program that we have at Laing O'Rourke that's been really successful is our Mental Health Champion program, and that is a one-day program that people do within the organisation, internally led, delivered by our people, for our people. And we have over 200 mental health champions in our network now. But the really important part of the program isn't just the one-day training course that they do, it's actually the reflective practice course that they do after the program. And that allows us to make a real sustainable change over a long period of time. And those reflective practice calls allow our mental health champions to come together and review case studies, share their experiences in a safe environment. And it means that we're also allowed to use them as kind of change champions across the hub to be able to deliver a series of campaigns and other initiatives. Now, the 5 Ways to Wellbeing is our campaign program. It allows us to deliver particular strategies under any one of these initiatives. And this was actually developed by the New Economics Foundation in the UK as part of the UK government's Foresight project on mental health, capital and wellbeing. And I think this connects back to what Helen was talking about, particularly about the importance of managing physical health as well as mental health. So we know that by using these 5 ways to well-being, whether it's connect, keep learning, be active, give, and take notice, we know that promoting these can have a really positive effect on people's mental health and well-being. So, for example, on the 1st of September, everybody in the organisation will be doing Steptember, and we find that that's been a really, really positive campaign that we've delivered over a number of years now that really gets the organisation moving and helps everybody to be active. And Safe Spine, Safe Mind is a program that we deliver on our work sites. It's a program that we've developed over a large number of years with Vitality Works. And this really does connect with our workforce, and it's a game of 2 halves. So the first half of the program is based around Safe Spine, which is a musculoskeletal program. And then the second half of the program is called Safe Mind. And it really is a really positive wellbeing and resilience program. And that allows us to really connect with our workforce across all our projects, and really ties in that piece that Helen was talking about around the connection between physical health and mental health. And we've found that there's been a really positive program for our people. It also allows us to deliver things like Safe Mind Toolbox talks and we have somebody who's in the field connecting with our workforce that they can talk to, also give them safe spine exercises, and it really does provide that whole body resilience program. Another key thing for us at Laing O'Rourke has been around our supply chain workforce. So about 85% of the people who walk through our door every day on site aren't actually Laing O'Rourke employees. So it's really, really important that we give them access to the same resources that our staff have. So if you go on our health and safety management system, it's a web-based system, and you can find that at the web page at the top there. It's lorhsems.com. On there, there's a mental health and wellbeing page where you can download all our mental health toolkit and resources. Now, what I really liked about what Helen was saying was about just how brutal the construction industry is on our people. And that really resonates with us because we know, that our people work some really, really long hours. You've only got to look at our rail people, work long occupations, or our FIFO workers, or even just our general projects, do work some really, really long hours. And it's really important that we provide people with tools to be able to manage their energy and time. And about 2 years ago now, we engaged with the Energy Project, which is about teaching individuals in their organisations how to manage their energy to build resilience and fuel sustainable high performance. Because we know that time is finite, you only get so many hours in the week. So the Energy Project is about teaching people tools and strategies to be able to manage their energy and capacity and allow them time to renew. And it's built around these 4 dimensions of energy: physical, emotional, mental, and spiritual. And perhaps one of the best tools that's available in the Energy Project is what's called an energy audit that we regularly use amongst our staff now. And people are given these tools to be able to manage their own energy and capacity. There's some really, really good case studies, and there's some case studies if you want to have a look at them on our website. You can go and view them there. There was a particularly good case study done with our crane workers in the Europe hub that I think's provided some really valuable research that supports what Helen was talking about earlier. So obviously the psychosocial hazards, whilst we've been aware of it for some time with the codes of practice, probably about 6 months ago, we embarked on starting to develop what our system requirement might look like for managing psychosocial hazards. And we are currently actually undertaking the People at Work survey, and it's live. It's been live for just over a week now, and we've had over 800 people respond, and it closes on Thursday. But this has been a great piece of work that we've recently undertaken, and we're really keen to hear from our people as to what psychosocial hazards they may have been exposed to in the workplace. And I think this is going to provide us with some really good, important data that's going to allow us to ask better questions in the future and allow us to really consult with our people. In summary, I think it's really important to use a positive psychology approach. And I think it's also really important not to deliver programs to tick a box. You have to be able to make a sustainable change. And that includes things like making sure that you have follow-ups after training programs like the reflective practice calls, or the people in the field doing the sustainable change if you're doing something like Safe Spine, Safe Mind. Because without that follow-up, it just become training. And I don't think that really connects with people. So I think it's really, really important that you make sure that it's providing a sustainable change within the organisation. And that's just some of my reflections of my time at Laing O'Rourke. And I know we're going to have some time for questions at the end, but I really appreciate the opportunity to talk about those today.